So Bob emails, what do you say?
Yep.
Long-term patron and anonymous clinician, she writes in and says, "Hi, Dr. Kirk and Bob. I am a new clinician in private practice, and I'm feeling just awful about a recent termination. I won't go into detail, but basically, I no longer felt safe with a client who had a history of violence against women, and I needed to refer him to anger management. We had between 5 and 10 sessions before I realized we were not a good fit due to the need for anger management, which is not an area I specialize. It was so hard because I could see the sad, scared boy beneath the angry, aggressive man, and it felt terrible to miss this opportunity for possible corrective experience being angry with a woman, me." So just chiming in, I think she's saying he was angry and aggressive with her, and she saw an opportunity to provide a corrective experience for him of not rejecting or matching fire with fire or something. But it was, she is basically saying out of her scope, and I think also just not what she is thinking is good for him. I don't know. But I was too terrified to continue working with him, she says.
Right.
As a result of this, I understand more about my possible countertransference, and I will update my line of intake questioning to include more anger management. But I'm having a hard time letting go of the guilt and regret for how it ended with the client. How do you navigate when you are unable to provide a smooth transition to a different clinician or service? How do you handle it when a client makes you feel physically unsafe and triggers your response, your stress response? Thank you. End of email. So I'm thinking from context and description is that he was aggressive either in a particular session toward, she says 5 to 10, or he was aggressive ongoing and became particularly aggressive. And she had a stress response, which is normal. Yeah. And it sounds like maybe spontaneously, maybe a part of her had been considering referring, but it sounds like the way she terminated and referred him, she looks back on and thinks that could have been handled at least more professionally or in a way. I don't know.
Yeah, we don't know.
But, because her question, how do you navigate when you're unable to provide a smooth transition? So maybe it was abrupt or something. And maybe there's no way around that because some terminations happen where, in fact, it rarely is particularly clean, right? Where you hand off a client to another therapist and the therapist is right there and there's already an appointment set and the client really likes this new therapist. Like that almost, if never happens, almost never, or actually might not ever happen. So maybe it's just a matter of that. Or if we knew the details or saw it, we might think, oh yeah, she was a little unglued and said it in a abrupt, hurtful, overreactive way, or who knows. But the final question, though, I think is important is how do you handle it when a client makes you feel physically unsafe and triggers your stress response, Bob? Well,
I'm going to presume that what she means is that the client was threatening her. Like it wasn't that she had some over anxious response to, somebody and, there's a question. I'm going to presume that this person was actually dangerous and threatening to her, in which case you have no obligation to work with somebody who is threatening you. Get rid of them. That is totally legit. It's not that they don't deserve help, but you have every right to feel safe as you go about your life and to not have people in it who threaten you. So I think it's fine. And if you're feeling guilty about it, well, first off, you don't know that it's a bad thing that they had that experience. Let's presume it was abrupt. When I read this email, you sent this to me earlier today. When I read it, I'm like, well, this just sounds like that Zen parable about the farmer with the horse. You know that one? You probably know that one. Yeah. So we don't know if it's a good or a bad thing. We don't know. It might be that it is the manure to which they grow something better. I don't know. It's feedback to them about their behavior. So that's a good thing. But I don't see any reason. I get why you'd feel anxious. Like, I think I'd feel anxious. I think I might fear reprisal. I don't know. But you didn't do anything wrong. And you have every fucking right to be safe in your fucking job. Is no question. So it's good to get rid of people who threaten you. You're not going to do your other clients any good. And it is, you cannot be the therapist somebody needs you to be if you're in danger of being harmed by them. It's just not possible.
But even if you could, or there's a way through that, or some clinical reason to stick with the client, there's a line. If a client crosses, then I don't personally care if I harm a client by rejecting them or doing whatever I need to do to protect myself. If it hurts a client for me to protect myself and to be safe, then who fucking care? I don't care.
So be it.
Yeah, it sucks. The world sucks, and sometimes, and it's not my fault, So yeah, I agree completely, Bob, with what you're saying. I will add, though, that we don't know exactly what happened, and if I talked with you, anonymous long-term patron, or saw it, or saw the video of it, I might have a different take. I don't know, but there's a good chance that, given your description, that I would not see it as a salvageable scenario for any therapist, let alone a woman who is being aggressively treated by a man, right? I have been in this situation a few times myself and have taken measures to terminate as well, even though I knew that this in all likelihood would harm the client in the end. But there's a line. And now I would say that also there are salvageable situations. And of course, as a man, I can't relate to the danger that women face, but I do have the majority of my trainees and supervisees are women, and some of them have run into situations like this. I've had a situation like this with a supervisee that it was along these lines, and I was so concerned for her that I actually went to her office to assess safety and to actually sit outside in the waiting room while she was in session with him, so that if I heard something or if she needed to, I would be right there, So
that's really cool.
There are scenarios where that is a very real problem. We're not talking about just someone who creeps you out or someone who has a violent past. Say we have a client who murdered someone or was, a convicted domestic violence perpetrator. We're not talking about something in someone's past. We're talking about in-session hostility and danger. And, that happens, of course, right? Because there's a percentage of people that are going to be that way, and some of those people are going to end up in therapy. Having said all that, I see people jumping to referral in general too quickly. I don't hear any evidence that this is a situation like that, but if I were your supervisor, that would be a question I would have, is this actually indeed crossing that line? Or is it salvageable? Or is this something that you're just not going to ever be good at, or you need a lot more therapy or training or something to be able to deal with? Because there are indications of danger that, we understand that there's a wide variety of ways in which a therapist would react to a hostile or aggressive-ish client, right? Some people would be quite put off and scared, and other people wouldn't, right? And there would be some bell curve in the middle. And so are we hearing someone at one end of the bell curve here, or are we hearing someone that is, reacting in more of the standard of care? It doesn't sound like it, but you also say anger management. And in terms of the terminology, at least in my neck of the woods, we delineate between an abusive a person who tends towards abusive behavior and someone who has an anger management problem. In that, in fact, in my early career, when I treated convicted perpetrators of domestic violence or intimate partner violence, in the initial phase of assessment, we would have to figure out whether or not they had an anger management problem or domestic violence problem. And the delineating factors were that if they just generally had an emotional regulation problem across the board, regardless of who they were interacting with, then that's an anger management problem and required a 10-week course on essentially emotional regulation. But if they were an abusive individual, then that was a year-long group therapy, long-term, very involved process that involved a complete personality change for these individuals,
That's rough. Not that they shouldn't change. I'm just thinking about what it would be like to work in that and how discouraging, because I'm just imagining there's limited insight and motivation.
Yeah, someone emailed in or commented or something that, because I will sometimes talk about this work that I did, and in my experience, it was pretty successful. I don't know if it was just the colleagues I was working with or the kind of clients that I worked with or something, or I had rose-colored glasses or something. But generally speaking, not all the time, generally speaking, the more senior group members would be better therapists, so to speak, with the new members than we were, because they'd been there, done that. And they were way more blunt, whereas we would be more soft in our confrontations. These more senior group members would really blast because they still had a streak of abusiveness in them, and judgment. But often it would be, and we would have to modulate it and manage it, moderate it. But often I would be celebrating, a senior member's blasting of a new member, and it was usually with compassion. It was just like, I hear what you're saying, but I was like that, but that's complete bullshit. That kind of stuff. I used to be like you, but that's bullshit. That notion that it wasn't a big deal, or that she's overreacting, or we're overreacting, or the judges, or we live in a society that is privileging women or something.
Oh, yeah, that nonsense. Right.
That is all complete bullcrap, and you've been listening to too much Joe Rogan and da-da-da-da-da, And I don't listen to Joe Rogan, but I don't even know if maybe Andrew Tate's a better figure. But anyway, so with people that needed anger management, that was a much easier thing to help with because it didn't require a whole personality, trauma recovery, re-education around gender and privilege and politics and everything. Whereas a true abusive, intimate partner violence perpetrator required all that. So it's possible that your client, long-term patron, was an actual abusive individual. And that kind of thing is more entrenched and gets worse the more they attach to someone, Mm-hmm. You also say, because I think you've been listening to the podcast or you've absorbed this, that it's like, okay, I now know my line here. And I agree with you, Kirk and Bob, that it's important to provide a corrective experience and to be a sacred place for people to come and have their problems. But I feel guilty and ashamed that I actually couldn't handle this one situation, which, we're saying, there's always a line there. And with proper care and supervision, and I hope that prior to that session, you had consultation or supervision about the scenario so that you could go into that termination with some backing, You should never be doing stuff like that on your own, even if you're 30 years into your career, right? Or post help around analyzing the full situation. The other thing I'll say is you could go your entire career and have this happen to you once. This is not common. The kind of extreme aggressive, unless you're particularly traumatized and sensitive, which can happen sometimes. But if you don't have that oversensitivity, the chance of you, even as a woman, because most therapists are women and most of my colleagues are women, most of my trainees are women, Most of my supervisors were women. This is a topic that comes up now and then. And what they will tell me from their experience is that it's very rare for a scenario. Maybe there are times when they feel a little scared or a little creeped out, but it's always handleable. But something like this where it's just crescendoing into aggressive, angry, scary behavior from a client to me is so rare that you could, without correcting for anything from the situation, just never run into this again and never have to deal with it. Having said that, I would have something there. But to screen, what do you say? Which is fine. And you could have it in your disclosure statement and tell people in the first session. And maybe there's a presenting problem that you could flag, but it'd be hard. But you could put it in your disclosure statement. It's like, hey, if I feel unsafe, here is the procedure. I will tell you that I feel unsafe, and I will tell you you need to do X, Y, and Z, or you need to stop doing A, B, and C. If that doesn't happen, then I will terminate with you because I, as a human being, deserve to feel safe in my office, that kind of thing.
Yeah, but are you going to say that to every client? They're going to think it's weird. And plus, I don't know that you need to have a disclaimer if somebody's a fucking threat.
Well, you don't need one, but it can be for a number of purposes. One is for disclosure purposes so that people just know.
Yeah. Well, that should be you have the right to terminate therapy.
Which isn't usually in the disclosure.
Oh, it's in mine. Well,
what does it say?
Oh, I don't know. It's a pretty long paragraph. I actually don't remember what it says.
I haven't actually looked at my disclosure in a while because it's been a long time since I've had a new client. So I actually don't know if I have it in mine.
There should be something in your disclosure statement about termination, that the clients have the right to terminate at any time for any reason.
Yeah, that's definitely in there.
And then that you also have the right to terminate, and then how you do that, without abandoning care or whatever. But this is an extreme situation. Like I don't want this person to think that they did something wrong if they were threatened.
No,
like that is no place in a therapy office, and it is rare. Most clients don't want to hurt the therapist. They like the therapist, respect the therapist, want something from the therapist. They don't want to hurt. They don't want to be a threat. So this may never happen again for the rest of your career.
Yeah.
But there's nothing in my disclosure statement about threat. But if there's a threat, then they're fucking out of there.
Right. The other reason why we put things in our disclosure statement is so that when we have to take action, we don't feel as guilty because we've written it down and we have a policy. We can even point to it as we're kicking them out and say, remember when you signed off and or I mentioned this? You're saying you wouldn't necessarily have to mention it. But I think that it would be prudent for her, especially in the preceding new intakes or maybe with other clients that she might worry about this, just for her own safety or her own sense of safety to say something like this, maybe to particular clients who present with certain issues, with certain vibes, because it sets the stage,
Yeah,
it's
you
just
can always ask about violence.
Yeah, and sometimes even if it doesn't, because, you think, well, what kind of a client needs to be told that, and do you really have to say that? No, you don't. But there's a lot of reasons for disclosures and a lot of reasons why we tell. Like, one of the big reasons why I verbalize, which is the standard of care, our confidentiality policies and ethics and laws, is that it relaxes me as I move forward because I've reminded myself, in a sense, by saying it out loud. And I've put it into the room in a very intentional way. It's not this thing that I think that they read in a disclosure statement that I think is there. I have said it. I've pointed at the elephant in the room and I've said that thing is there. And I personally feel better 6 months down the road when it does get challenged and I do have to say, make a mandated report, because I remember saying it verbally. Do I have to have said it verbally to feel okay doing that in 6 months? No. But I personally just feel a lot more grounded and intentional and in alignment with what I have put out there. They didn't push back in the moment. I told them verbally. And so just for her own sake, it might help for her, especially with particular clients, which is fine to do. People are like, oh, you're discriminating. No,
No, you have a zero tolerance policy around violence, then.
But you're also like identifying, if you have a 5-year-old kid client, you're not probably going to run into that. So you don't have to have that, you can pick and choose your kinds of disclosures that you want to emphasize. And maybe with particular clients that seem to have that potential or have that kind of vibe when you're making the initial screening, maybe you say something like, so I just want to say from the outset, this isn't personal, but I've recently ran into a situation where I need to clarify this policy that if I ever feel at risk or a danger of my personal safety, even if it's implied in a client's language, I will terminate immediately and refer. I hope you understand. I think, and maybe you frame it in a bit more flowery language.
I actually like that. Just matter of fact.
Yeah.
Here's my deal.
Yeah. I imagine most clients would say, oh, okay. Yeah. All right.
Yeah. Like, oh, did something bad happen to you?
Yeah.
Right.
Yeah. That's why I was thinking maybe don't mention that something happened to you recently. You just could say, so it's a standard practice that if, I have a high tolerance for various different feelings that a client would have, but if all of that emotionality results in you being aggressive and hostile and threatening to me, then as other therapists will, I will terminate. I just want to put that out there. Not that I think this will happen in this moment.
I think part of the reason you're making this distinction here is you don't want therapists to get the idea that they can terminate easily or lightly. Like,
right.
You signed on to do hard work, do the fucking hard work.
Yeah.
Right? And also, you deserve to be safe in your job.
Yeah, and I'll be specific that I've heard stories from trainees or colleagues or even people online that will claim they feel unsafe with a Republican just because their client is Republican.
That's just silliness beyond belief.
Right. So people have an over tendency to use the word unsafe or the word safe. They apply safe. When we're talking about this safety that long-term patron is talking about, what she's talking about is being physically assaulted. And that's an issue of safety.
Absolutely.
Someone
that's
having
safety.
A political view that is different than yours.
Yeah, that's a bit precious.
Yeah, that's not a matter of your person. That's not what we're talking about when we're talking about safety.
Come on, people, be real.
Now, if you want to say safety, the word safety in terms of politics and what happens when people vote certain ways, then okay, but it's not in the moment you being physically assaulted. That those are different kinds of safeties that we're talking about. Anyway, all right, let's take a break. We get back, more emails. What do you say?
Yes.
All right, back from the break. Anonymous patron from Hamburg. He writes, I recently listened to an episode with you and Bob. Bob was talking about how some people with borderline personality disorder are over-regulating their emotions. Bob, do you remember that?
Yeah, I remember that.
Tell me about that.
Well, they're referring to that I don't know about the DSM or any of this shit, but there's as I understand it, a group of folks with borderline personality disorder who are considered over-controlling, and they do a form of DBT, RODBT, radically open DBT, wherein there's a lot of practice around, instead of regulating emotions, sort of like downshifting on the intensity of emotion, it's more like experimenting with self-expression and stepping beyond my, sort of rigid, maybe lonely existence and over control of how I feel and how I act, and experimenting with acting in spontaneous ways or different ways or assertive ways or whatever, and then using the community of the RODBT community, because they do this in group, and the personal therapist, to kind of get feedback about how it went. They also spend a fair amount of time teaching how to read facial expression so that you get accurate information about, because not everybody knows how to do that. And so the idea would be to pay attention to that, because what I tell myself might be happening may not have anything to do with actually happening. And there may be real data and body language and facial expression to inform me about, not everybody here hates me or whatever, right? Like they're smiling. Oh, that means they like me, or they like what I said, or whatever, right? Or they feel friendly or whatever, right? So radically open DBT for those folks who have problems with over emotional control. I think that's what this person is referring to.
Yeah, I like that. So is the second part, the accurately reading body language, not a part of regular DBT?
That's a good question. Hold on a sec.
Because you taught DBT classes.
I did for years. You'd think I could remember this just instantly on top of my head. No, it isn't.
Interesting. For some reason, I thought it was.
Yeah, it makes sense that it would.
Yeah.
But it isn't.
But talking about related topics are a part of DBT, right? But just not specifically like analyzing exactly how you read people's faces.
Yeah. So no, not that specifically, but I mean, it's sort of implied in things like mindfulness and reality acceptance, but it presumes that you can actually perceive. And we never taught anybody anything about, how to read body and face cues accurately. That's not part of DBT curriculum.
But those terms, the mindfulness and the reality acceptance, have components of questioning whether or not your evaluation of other people and their internal state is accurate.
Is accurate.
Yeah.
Right.
Okay. So going on, he says, I also remember you stating in a different episode how you dislike the term quiet borderline because it suggests every presentation of borderline is overt. Just chiming in. Yeah. I don't know if I said I disliked the term. I just think that it's a representation of the cartoonish version and stigma around borderline, that you have people that very much identify with the condition but do not self-evaluate as being the cartoonish version. Now, the cartoonish version of someone with borderline does exist, but it's a type, and perhaps the most noticeable, and maybe the most annoying type to both personal relationships and for therapists. These are the suing individuals and the people that are hostile and very noticeably emotional and difficult to deal with. And those people exist. There are abusive people with borderline, but there's a wide variety of, borderline doesn't define you as a person, doesn't define your personality. It just is one of the defenses that's involved in the full constellation of a human being. But this notion of quiet borderline, it implies that when I'm talking about non-quiet borderline, or when I'm just talking about borderline in general, that I'm talking about loud borderline. But when I'm talking about borderline, I'm talking about all sorts of people. In fact, when I'm talking about borderline, I am rarely in my mind visualizing the cartoonish version, Anyway, going on. I can relate to these ideas a lot. I find it very confusing and contradictory in that I feel very numb emotionally, and I feel extraordinary highs and lows about relationships. So I think this is him saying he resonates with what you were talking about, Bob. But I feel unable to release or show any of these emotions. Yet most people with borderline seem to suffer from the opposite, which is emotional dysregulation. I would appreciate if you could share I'll just go on. I was going to chime in, but I would appreciate if you could share your experience with less overt presenting people with borderline, and to hear your thoughts on what could cause both. Can be present at the same time, and I wish you a wonderful day. End of email. So, Bob, how can that be that you would have this emotional numbness, but also feel extraordinary highs and lows about relationships and unable to release or show these emotions? What do you think, Bob?
I don't know. I mean, there's probably 1,000 different things that could be involved in that. Tremendous shame, conditioning. You've been punished for self-expression, abuse, right? Unfamiliarity with how you feel. Like sometimes we can't say it, and sometimes when we say it, sometimes, let me start over. Sometimes we don't know how we feel. That's true a lot of the time. And then sometimes we know how we feel, but something stops us from expressing how we feel. So, those are similar to what this person's asking about or whatever. But I don't know if I could make an intelligent statement about why do people, underexpress how they feel. But I would just guess shame is the emotion of hiding. So a lot of it could be just related to that.
Yeah, I think you put it well.
Yeah.
I mean, you basically said it, but to say it in much longer words, which is my typical way, is that you can have the abandonment and betrayal that is at the core experience and trauma for someone with borderline, and conclude that you're worthless and that other people are in a constant state of either preparing to or in the process of rejecting you and abandoning you. And also experience, as you express your feelings about that or other feelings, that you're abused or ignored, such that you also realize that you're not safe to express yourself at an early age. So you have those dual experiences, and it results in this, where you feel all the feelings of borderline. You have all the experiences, the disconnection from the self, inability to regulate your emotions, having extreme primordial emotions throughout the day, extreme distress, self-hatred, distrust of others, highs when you have a glimmer of hope in relationships that are always dashed eventually. And yet, as you have feelings neurologically, you cannot express it to yourself or to others, because that is met with a quick wall that goes up, because as a child you would be put down and possibly even abused. So you don't show it, and on the outside you seem like everything's cool. You might even come across as being aloof and avoidantly attached. But in reality, it's a loud silence that's underneath everything.
Nicely put. Loud
Let's
silence.
read another email. Long-term anonymous patron, she says, "Hi, Dr. Kirk and Bob. I have been asking myself if now I need to take care of myself too much. I've been asking myself if now I need to take care of myself too much." So in reference to us saying take care of yourself. "I used to be that sort of person who was always up for anything and didn't mind having rough conditions. I was very flexible. This is very much valued in my line of work, which is physically intensive and more on the adventure side. I started therapy 7 years ago, and I've learned a lot about my needs and emotions. My job requires me to travel a lot, which I used to love. Now I just want to be home with my partner and my dog. My job always requires me to have short sleeps, often long working days. My job also requires me to have short sleeps with long working days. It used to not bother me, but now I really struggle with these things. My job is well paid and the atmosphere is nice. If I go to a more regular job, I'll have to reorganize my finances significantly." Just chiming in, just speculating about what sort of job. Now, she's trying to remain anonymous, but I don't know, it sounds like professional rock climber or something.
I was thinking oil rig worker.
Okay. So going on, it got me thinking if after not really taking care of myself for so many years, now I'm overly conscious about what I need and seem to struggle with the struggles. I feel guilty for not working as hard as I used to, but I guess wanting to rest and be safe at home are very human things. Wondering if you or Bob have any thoughts to share. Thanks. Bob, what do you think?
you sent this earlier. I really liked this email. I thought it was really what a wonderful problem to have, right? It just looks like. Did you see? You remember that claymation show when we were kids? Santa Claus is Coming to Town. You remember that one?
Oh yeah,
with the Winter Warlock.
Yeah.
Yeah. So the Winter Warlock is this big, tough guy who kind of guards the forest, and Kris Kringle wants to get through the forest to Christmas Town or wherever the hell it is, and the Warlock is blocking his path. This big, burly magician guy. He's scary. I remember I used to be really scared of him. And Kris Kringle just offers him a toy, a choo-choo, right? Gives him a train, and he melts, and he becomes very soft and gentle and not so angry, and he seems very kind and decent and, like just a good dude, right? And he even changed the way they film him. He's angry with the pointy teeth, and then they make him a lot softer or whatever. So when I read your email, I thought about that story, and I thought, that's good. Like that transformation, the Winter Warlock was really glad to have, and felt really fortunate because he was loved. So here you are, you're going to therapy, and somebody loves you, your partner, your dog, and you're letting that in, and you're appreciating it, and you're noticing that you want to take care of yourself. You want to sleep the way your body, that leaves your body feeling rested, and you are less interested in making money and are cool with, if you had to reorganize your finances or whatever, or, change your life or whatever, because it gave you time to spend with your partner. When you come to the end of your days, you will not regret that. And you might give up money in order to have it, but that's a bargain that you get to decide on. You don't have to do it. You can do the other thing. And, there's good bits about your life, but I really like that what you seem to be doing is slowing down and actually listening to yourself when you were ignoring yourself and just push the way a lot of us do, regardless of the impact on your soul. So this is a good thing. You do not sound like a person who's treating yourself like you're precious and special, like a little snowflake who has to be delicately, whatever. You just sound like you're growing up and becoming wise and maturing in a really lovely way. So keep at it.
It seems like that touched something in you.
Oh, yeah.
What's that?
Well, I like this person's transformation, right? I probably like a little bit more of that myself.
Is that what it touched?
No.
Or was it just,
there's a
not
sweetness,
just, but was it love for another?
Yeah. There's a kind of an innocent sweetness,
Like a happy ending to a movie makes you cry.
Yeah, like that. So what a lucky partner they have and a lucky dog. And, fantastic.
Tears of joy.
Yeah.
I have a lot of thoughts. Bob summarized it well. I think I could add that, the pandemic did a number on a lot of us. And similar to you, long-term anonymous patron, I am also a lot less adventurous today than I was before the pandemic, like a lot. Before the pandemic, I was rarely home. I obviously worked at the university, so I was gone at that point. But I also went out all the time. I socialized all the time. I went to movies I would go to 2 movies a week sometimes. That was not uncommon, maybe 3. I loved movies.
Band practice
at the practice studio or playing gigs, that kind of thing. And pandemic happens, of course, we're stuck at home, and I think also just getting older, slowing down, aging, having a different kind of lifestyle. When we moved into the house we're in right now, we really both tried to make the house ours and tried to optimize the living space and the yard and the nature. Huh?
You made a home.
Yeah. My office, I renovated this. This used to be 2 bedrooms, and I had contractors come in and knock down walls and do all the things. Soundproofing, right?
You made it comfortable.
Yeah.
You've gone through chair evolutions and desk evolutions and bookshelf evolutions.
Yeah.
And this is, I mean, I like coming into this room. It's like your space.
Yeah.
Got your kimono on the wall and your grandmother's kimono on the wall. And
Yeah.
hey, I was thinking about, I have never asked you about the horse in the box up there, but you had that when you lived on Meridian, didn't you?
Yeah. Observe
I can't believe I've never asked you about it. What is it?
You would think as a Japanese doll, I don't know what they call them in Japanese. I'm not particularly good with that, but there's a decoration that you'll often see in at least Japanese American homes. I don't know if they have them still in Japan, but Japanese Americans are often of a different ilk than Japanese people in Japan. But at least here in the United States, we tend to have in these glass boxes these dolls of various different types of dolls, whether it's a woman in a kimono or a horse, like is here, or a samurai or something. And you would think that that would be from my Japanese side of the family, gifted to me or experienced. But no, this almost all of the Japanese stuff that I own, decor, aside from my grandma's kimono right there, is from the white side of my family because my mom's parents became very enamored with Japanese culture. I think partially because initially they discriminated against my father and didn't want my mom to even date my dad. My parents had to date secretly. They were aggressively against it. And when I inherited things from them or was given things at Christmas or birthday or something, a lot of times it would be this sort of stuff. And so that's from them.
Nice.
So when I see that, that's what I think of. And I got it at a very young age. It's kind of funny, that, it's true. Whenever I move, because you just think about all the places you move to in college and beyond as an adult. I've probably lived in a dozen or more, maybe even 20 places since I've been 18. And yet that horse in that glass cage that has a door on it is something that in all likelihood has been on display everywhere I've been. There's always a place for that because it's I think a pretty horse, and it means something to me and culturally and also familially, and it's been there since I've been a kid. I can't remember when I got it, maybe when I was like 12 or something, I'm not sure. Anyway, so that's a much longer explanation.
Is that the only thing you have? Like that's probably the only thing you've carried from 12 to now. Maybe guitar.
No, even guitars, which bumps me out. Well, there's one guitar my very first guitar that I still have. So yeah, but not since I was 12. I got that when I was like 17 or something. But true, I'm trying to look around and see if there's anything else that I would have kept. A lot of the things, the childhood things that I have, I actually reacquired, like my set of Lord of the Rings books.
Yeah, I was looking at those. We had that same set.
You have that same set?
My father had it, yeah.
Yeah, they're different. It comes in a box, but a lot of the things that I have are things from my childhood, but I lost or something and then bought on eBay to reacquire.
Oh, right
anyway.
on. Yeah.
So getting back to the email, so it's possible that long-term anonymous patron, you were going to go through this transition anyway, just as aging or pandemic related as well. But another possibility is that it's very common in therapy when I'm working with someone that was denied the opportunity to connect with their needs, that as they get to know their needs, they clash with their lifestyle, maybe even their marriage. And I will tell people this, that it's glorious and very healthy and pleasurable and life-altering in a positive way to connect with your needs, because when you know them, then you can meet them. And you know when they're not being met. And you can move away from things that cause you to feel pain, and you can move towards things that are meaningful and gratifying and pleasurable to you. The downside is that you might realize once you take the blindfold off that you are not living the life that meets your needs, and you might have to make major changes across the board. We can't know that. That's the risk we take. And that question will be a barrier to you connecting with yourself. But I personally would recommend adopting the philosophy that it's better to know and to change and to go through that than to live in the darkness. But it's not without its consequences. Let's hope that doesn't have to happen, but there's a chance, and that happens sometimes. I would say that with career or marriage or lifestyle, there might be a way to shape those things without discarding them to your needs. Maybe some major changes have to happen in your career or lifestyle or marriage, but changes are likely going to occur. The chance that you randomly are living the life that are meeting your needs without knowing your needs is not very high. So it's possible that as you heal, you are realizing that that lifestyle doesn't meet your needs, that being away from home often, by not getting enough sleep, by having a high stress lifestyle, actually had positives to it. And that right now, 7 years into therapy, as your life looks a lot different right now, you are grieving that and you're missing it. There also could be a voice in your head that is saying, which is universal, by the way, as people make this progression into connecting with themselves, there'll be this voice that will tell you to deny your feelings and to go back to the way things were. You think of yourself as so special, or you're boring now, or something. There's a lot of denial and self-delusion involved when we are trying to self-justify a lifestyle that we somewhat know is not healthy for us. Now, I don't know if that's the case. Another scenario is that you're cocooning as a phase, and that 7 years from now, after more healing, you'll be ready to emerge into the next chrysalis of life, and your wings will flutter even more aggressively and more gloriously than before. So it's unknown, but the key is to follow your nose. And this notion of taking care of yourself too much is a classic in-between phase that I will hear from people that are transitioning towards connecting with themselves. There's a judgment there. It's like, that doesn't make any sense. Now, if you are concluding that you're cocooning too much, that you're playing it too safe, that you're irrationally afraid of taking risks, even though you need to take those risks, you need to stop being afraid of everything, stop being cocooning, stop being too safe. If your needs are met by pushing yourself beyond that, then do that. But I'm not hearing that. What I'm hearing is you're judging yourself for taking care of yourself. You said, am I taking too much care of myself? I mean, just really think about that question. And I get that universally from people as they connect with themselves. There'll be this notion of, I'm being too selfish. I'm being too self-indulgent. Who am I to deserve this? There will be often a career component or a particular job component of, this job is abusive to me, or my boss is abusive to me, or customers are abusive to me, or this lifestyle is abusive to me. But there's this self-justification, and also messages often from the outside, maybe even from one's parents, that is the way, that success and prestige and money and all that stuff, society. As you get in connection with your feelings, you might start to realize, wow, I'm being abused. And then you very slowly start to push back on that. And then as you do that, you start to feel better, but there's this remnant voice and this gravitational pull and this self-judgment that there's something wrong with you. That's this old defense. It's this old policeman on your behavior that is telling you that you're being selfish, that you're being self-indulgent? Who are you? Do you think you're better than other people? What kind of a weak person are you to constantly be taking care of yourself, right? And it always has that element to it. Like for me, I don't have that history, so that when I think about my life right now, I don't beat myself up for it. I don't say, am I self-indulging? Maybe I'll say that kind of, but I don't really believe it in that way. What I will say to myself is, maybe I would benefit by getting my needs met by pushing myself to leave the house more often or to step outside of my routine, that kind of thing. But it's not that notion of the way that you're phrasing it, an honest patron, is, am I taking care of myself too much? Do you know what I'm saying, Bob?
I do.
Okay.
It's good that you're saying it.
All right, let's take a break. When we get back, one more email, and it's the last email.
Whoa!
All right, back from the break. Last email. Long-term anonymous patron. She says, "Hi, Dr. Kirk and Bob." And by the way, dear listeners, if you say, "Hi, Dr. Kirk and Bob," Stacy puts it in this document for me to potentially read on air. So since we don't have any emails, we're a blank slate.
I'm out of a job. Come on, people.
Hi, Dr. Kirk and Bob. I'm a relatively new clinician in private practice.
Yay.
So another new person in private practice. Last year, I was under severe stress unrelated to work. I wasn't eating or sleeping well, and I ended up having a manic episode. I was hospitalized for a little over a week. I have returned to my practice. I am medicated. I have a good therapist. I have a strong support system. And my eating and sleeping routines are healthier. I am under supervision, and my supervisor expresses trust and confidence in my abilities. So just chiming in. So severe stress, her first manic episode, which is no joke. That is a very difficult period of time. It can be very disconcerting, demoralizing to someone to think that could happen to them at any moment, And to be hospitalized for over a week for a manic episode indicates something, you know what I mean? But she's also saying, I've done all the work: medication, therapy, support system, lifestyle, supervision. My supervisor knows, and okay. But there's still a part of me that doesn't trust my ability and feels that I don't deserve to be a therapist after seeing how bad things can get for me. I have always struggled with depression and anxiety, but full-blown mania is unlike anything I've ever experienced before. I feel as though I am haunted by the memories of psychosis. It feels like the cat is out of the bag, and there is this looming possibility of things going off the rails again. I know I can't possibly be alone in this experience, but I feel a lot of shame about it. Maybe shame is why I haven't heard many anecdotal accounts from other therapists experiencing something like this. What is your anecdotal experience with clinicians who experience mental health crises to this degree? Thank you for your time. Your podcast continues to be one of my favorite personal and professional resources. End of email. Bob, what do you think?
Well, God bless. I'm glad you wrote in. I don't know. I think anybody who'd gone through that would probably have similar kind of thought and feeling. And, 1,000 gold stars for the way you have responded to it. You've accepted it. You're proactive about it all. You're keeping things in balance. And, I don't know anything about your clinical skills. I'm just going to presume that they're awesome and that you're doing great work for your people. And I wouldn't worry about this other shit. It's just a bit. And yeah, it could happen again. I think anybody would be, more or less have that on their mind from time to time, probably fade over time as, things go on. If it never happens again, you probably forget about it. One thing about it is that it gives you felt experience, a lived experience that chances are you're going to run into clients who have had the same lived experience, and you'll be able to relate better than someone who had never had an experience like that. So, that's good. That's useful. But in terms of having a psychotic episode, it doesn't mean anything. It sucks. It's terrible. It was frightening as hell. Yeah. But it has nothing to do with whether or not you're a good therapist. Now, your question was, what's my anecdotal experience of clinicians who've had a manic or psychotic episode? I can't think of one. And maybe you're right. Maybe it's happened and people just don't talk about it. But to be honest with you, I actually don't know.
It definitely happens. I have clinicians. I'm trying to think of, I have colleagues. I was trying to think if I've had a supervisee or a trainee. I must have at some point with all the hundreds of people. But yeah, this happens. So there are two components to your email here, Long-Term Anonymous Patron. One is, it sounds like an internalized voice of shame and not being worthy, that you say that you think that you don't feel worthy of being a therapist anymore. You say, I don't deserve to be a therapist. That, in all likelihood, is a voice from the past that is unfair and is problematic and should be attacked, because there's nothing about this that indicates anything about whether or not you deserve to be a therapist or not. The other component to this, which I think is universal in terms of the way this can feel, is after one's first psychotic episode, and particularly if you're younger, if you're like in your 20s or early 30s, this could be a sign of things to come. Mania can show up, particularly if you've had a tendency for mood disorders in the past. It can slowly cycle to escalation at around 25 to 33. And unless things are really watched carefully, and even sometimes when they are, then it can happen again. So it's not irrational to worry about it happening again. Now, it's possible it won't. It's possible it was a manifestation of not being on medication, and obviously stay on medication.
Yeah. Sleep deprivation, maybe.
Yeah, could be. So these are all things. So it's normal for you to wonder and to be shaken and insecure and terrified. And, I can't remember how you said, it feels like the cat is out of the bag and there's this looming possibility of things going off the rails again. Well, that's rational, Long-Term Anonymous Patron. The cat is out of the bag. Before you had this psychotic break, the assumption that you would never have a psychotic break was fair because it's not typical. But now that you've had a psychotic break, the risk of having another episode of psychosis is much higher. So there is a looming possibility of things going off the rails again. That is very real, and that's very depressing. Now, I'm not saying that it will happen again, and I don't want to be pessimistic, and I'm not pessimistic, because you're doing a lot of things to stave off the possibility of it happening again. But it's normal to worry about that, and it is, I think, universal, especially when people are being realistic about this, that there's a worry there. Now, the way to protect your clients from you, which I'm sure that you're thinking about and talking about in supervision, and maybe even with your therapist and with yourself, is how do you detect the triggers and the initial phases, even if you have what is considered to be the early phase indications and it doesn't lead to psychosis. It's better to be safe than sorry, right? So having a lot of monitoring in place, not only from you, but from other people. Because with hypomania in particular, one can enter that state and either not be very aware of it because it's sometimes subtle, But also, for some people, when they enter hypomania, the hypomania actually prevents them from having a lot of self-awareness. Also, hypomania feels good. So there can be a personal incentive to go into denial about it. So with mania, and particularly mania with psychosis, it's important to have other people observing things so that they can point it out to you and to your support system so that everyone can take action. Your supervisor is a perfect person to be informed of early signs. And again, better safe than sorry. So what you would want is that your support system has a very quick response, better safe than sorry, to reach out to your supervisor so that your supervisor can take action to monitor, right, initially, and possibly even against your will to inform your clients that you are unfit or that you're unwell or so, and I would set up a safety plan along those lines. Now, hopefully it won't come to that, and in all likelihood it won't, but that is the responsible thing to do from all concerned parties, your clients, your supervisor. You don't have to tell your clients necessarily what's going on, but you could, depending on how you worked it out with your supervisor and what your approach is. But so I would attack that shaming feeling as unfair to you, but I would also value the recognition that this was a horrible event. It is a horrible thing to go through something like this, to not be able to trust your own mind, to not be able to bank on your selfhood to be sustained over time. It fucking sucks. It's like having your mind infiltrated by another creature, and you just completely lose control. And in all likelihood, especially since this was your first manic episode, there was probably a lot of damage, or at least a lot of consequences, right? And that's very real. And if you're a therapist, right, and you're responsible for people, at least their clinical care, there's a lot at stake. Now, do not beat yourself up. I have worked with people who have had psychosis in the past. I can't think of anyone off the top of my head, but I know that I have. Unlike Bob, I have been exposed to so many clinicians because of my work at the university, right? I meet a lot of people, and the students that I work with often are assigned assignments, but sometimes just as a nature of the relationship, will tell me about their life, right? And will tell me about something like this when they wouldn't normally out themselves in this way. And I know that I've heard things along these lines. And yeah, it's not the sort of thing that people advertise, because if it got out there, there could be there's a real stigma around this, right? Now, you'd hope that therapists wouldn't have stigma, but I can absolutely see a scenario where a majority of other therapists would not refer a client to you, or at least would have a question mark if they knew this about you, which is completely stupid. But it drives people underground. And I don't know the prevalence of psychosis off the top of my head in general, but I think it's somewhere on the order of 3 to 5% or something lifetime, right? So you take that percentage and you apply it to therapists. There's no reason to believe that people with a history or a risk of developing psychosis, there's no reason to believe that those people wouldn't necessarily become therapists, you know what I mean? Maybe it's a slightly lower prevalence, or maybe, I could see it going either way. I could see more, I could see people with either a future of psychosis or a past of psychosis. I could see them being attracted to being a therapist because they're interested in psychology and they've been exposed to psychology and psychotherapy in all likelihood. Or I could see it going the other direction, where they're less likely because they have a hard time seeing themselves in that role given what they've been through or something. I don't know. But if we just think about typical averages, we could imagine a lot of people. And there's probably research on this, I didn't bother to look it up. But yeah, so there's a grief process that you're going through, and it's important to go through it, and you're going through it, and there's more to do. The grief, the loss that you are experiencing is the loss of confidence or the loss of being able to depend on your brain within certain limits, right? You can no longer do that. You can't depend on your brain to be consistent. Now, you can depend on your brain if you have all the system in place to be within normal limits from hour to hour. If right now there's no sign of psychosis, and these things don't happen suddenly usually, right? There's a ramp up, particularly with mania. It can be quick sometimes, but not like, the snap of a finger, not typically anyway. So you can absolutely, if you have all the measures in place, you can absolutely trust that the near future that you can depend on yourself. And if you have all the measures in place and the safety plan and everyone is on board and no one's shy about informing anyone else or hurting your feelings, then you can depend on that system working to protect not only your clients, but you and your life. And whether you were a therapist or not, this is important when it comes to, after having your first episode of mania and or mania with psychosis, all these things are necessary. And plenty of people live very happy, secure lives. It sounds like you've already done so many things. You're doing way more than the typical person does after this. So you have a lot of measures in place. So that's a very good sign. And you have the resources, which is great. There's a very good chance that a year from now, 5 years from now, that you will feel much more secure in this system. Maybe in that time you will have another manic episode, but you will know that the measures are in place and that you're still a good person and a worthy therapist. All right, well, that does it for that episode. Everyone out there, please take care of yourself because
you deserve it.